So I'll start with the academic part. After my neurology training in Sri Chittathirunal Institute, I joined back actually CMC Ludhiana. And over the years of research and clinical services, in 2018 I took over as a principal of the college. And there were several changes I brought in, particularly among medical students. There was one international conference which I organized with them. About 350 medical students from 7 countries had come. And there were several other college-related activities. One important program is a PG Wellness Workshop, when I realized there's so much of mental health issues, not only with the undergrad student, but also among the PG students. I think Dr. Dennis Xavier and one of his colleagues had come. We had a 3 days PG Wellness Workshop. And after that, probably 1 year later, NMC had made it mandatory to take care of the PGs. And our center is NMC Nodal Center in FEMA Regional Institute. There are several medical education innovation that happens. And we also play an advisory role to the National Medical Commission. So this is the Congress in 2019, and we partnered with ICMR and also World Stroke Organization. So there are a few important research and innovation I want to highlight. One is the creation of Indian Stroke Clinical Trial Network called Instruct. It started with 31 centers. Now we have 51 centers. We are in the 9th year of running. So far, about 6 stroke clinical trials have been conducted in India. Close to 1,000 stroke patients have participated in these trials. And also innovation in terms of models of stroke care. Number one is the physician-led stroke care, which we had tested in Tezpur in one of our affiliated hospitals in Assam. And after that, it has been rolled out in several states in our country, the hub and spoke model of stroke care using physicians in states like Punjab, Himachal Pradesh, Maharashtra, and few other states. And another program, it's a mobile stroke unit project as a demonstration project. We did it in Tezpur and Dibrugarh. This was during the COVID time with our previous DG of ICMR, Dr. Balram Bhargav. So it's basically a CT scanner and in the ambulance. And in Tezpur, even now, there's no neurologist. After almost 5 years of success in this program, the ICMR has handed over the 2 MSUs to the Assam government. There are a few other states who are willing to adapt that model. So we received the recognition from ICMR as a Center of Excellence for Stroke Research and also the WHO Collaborating Center for Stroke. We are the only center in the world to be recognized by WHO as a WHOCC. So these are some of the recognitions for the work in stroke, and it was also highlighted in Lancet Neurology as a profile. Clinical care, that is my heart, and several initiatives started the epilepsy services, stroke unit. This is the only study where we have compared stroke unit, stroke patient managed in medical ward and managed in stroke unit, and we are able to show a significant benefit. The first paper on intravenous thrombolysis from LMICs, and we are the first certified stroke center in our country as an advanced stroke center by the NABH and World Stroke Organization. There are several new things that we had started. We are the only medical college in, at least to my knowledge, in Northwest India where the DSA lab is under the Department of Neurology. It is always I would say, a war between specialists, but I was able to do this, and as a result, we are planning to train more neurologists. One of my students has taken up neurointervention, and we are going to start fellowship so that we can develop the skills force. And I think my important contribution to the lead up to the Sitaram Jaipuri Award is the policy and public health. And some of the models that we have developed has been rolled out by Indian Council of Medical Research, the population-based stroke registry in Ludhiana, urban as well as rural, and NCDR Bangalore. They have done that in 5 states in our country. And also working with WHO, I'll just mention some of the activities. And more importantly, my work with World Stroke Organization. And I'm the first Asian to be elected as a president of WHO. And this particular award really is, I would say, has given so much of confidence in terms of achieving more, not only for our country, but also globally. Institutional building, I mentioned certain activities, but I think I started the institutional journal, research symposium, an intramural funding scheme, a research center, and also as part of WHO, we have trained about close to 100 future leaders globally. So WHO model, this I want to highlight, where we have worked with WHO CRO, and we have developed a stroke care program in Bhutan. And in Bhutan, before this program, there were no stroke units, but through this capacity building program, through WHO CRO and WHO, we are able to start 3 stroke units. A similar initiative with Maldives, there are 2 stroke units now, and 1 stroke unit will be soon certified by World Stroke Organization. And Timor-Leste, it's a very remote place, just northwest of Australia, a very difficult place to go. And we did a training program for 4 days, and the government now has invested into a stroke unit, physical infrastructure, and also they are planning to release stroke guidelines for the country. A similar initiative last year in Jaffna, we all know how it was affected by the political unrest and war. And this was a 3 days program supported by World Stroke Organization. It had a tremendous impact in terms of capacity building. I am also in partnership with WHO Western Pacific Regional Office in Manila. Last year we had a policymakers meeting for stroke care. Out of 33 Western Pacific regional countries, 17 countries, ministers, policymakers, and healthcare professionals participated. And also had an opportunity to visit Iraq, the country office there. We have come up with a plan and for improving stroke care in Iraq, and first center will be certified soon by World Stroke Organization. I think why I want to show this, this is in lead up to the highest level of influence in policy for stroke in the world. All these activities really helped me to get to that level. This is only last year, November, if I'm correct. Alarko Caesar was in charge of the NCD program in WHO headquarters. She was in Jaipur. We had a discussion. And also other neighboring countries, Nepal, the activities with WHO implementation, advocacy, raising awareness on stroke, capacity building. The highest level, probably I would say, as a stroke advocate, last year we had a side event in WHA in Geneva and UNGA. We had an opportunity to make statement. I think Dr. Narula also was there in that meeting in New York. And that we also had a side event there. And finally, this is probably the ultimate desire which was fulfilled, to have a standalone resolution on stroke passed in the WHO Executive Board on February 6th this year. And we are hoping that this will be adopted by the WHA World Health Assembly in May, and looking forward for great improvement of stroke care globally and also in our own country. So what this award has done is probably, I would say, after I received the award, I not had any time to think what should I do with this fund that I received. But I've been continuously traveling and I would say influencing policymakers in different countries through World Stroke Organization and WHO, CRO, as well as WHO headquarters. And I think today's meeting is an eye-opener for me. I should do something back to the society with the funds that I have received. And I'm really grateful to this Sitaram Jaipuri Award and the foundation for this great opportunity. Thank you very much.